right, so a hand on the heel to kind of control it, hand on the distal thigh, just relax for me. All right, so flexion of the hip and knee and extension, just back and forth. This is a fairly common range of motion that's done. All right, and of course it can be doing active, assistive, or actively. All right, while I'm thinking about an ankle range of motion. All right, what do you think about my technique with dorsiflexion? Just relax for me.
You're holding the muscle that's...
Okay, we actually should have the knee flex to avoid passive insufficiency of the plantar flexors. If we're actually doing range of motion. Okay, so what do you think?
Are you sure that
There's a better way to have your hand placement. Instead of pulling on the forefoot, have a hand on the calcaneus or the heel, forearm pushing against the forefoot. And that's a much better way to do the movement. It's not so important with range of motion, but when we get to stretching, where we're holding it, this is a lot better way to do it. A lot of people think you can cause too much stress to the foot if you're just pulling on the forefoot. So a hand on the calcaneus, forearm against the forefoot, and going back and forth that way. Okay, for plantar flexion, which is not a common range of motion to do, and again, one hand on the calcaneus, one on the forefoot when you do it. It's more commonly that you're going to do dorsiflexion. All right, what about